Hello, good morning or afternoon, wherever you're at. Apologies for the delayed beginning to today's live webinar, but we are happy to have you here. And today we're going to be featuring a detailed overview of how to submit 2022 data online for our 2023 outpatient recognition programs, Target BP, check change control cholesterol, and Target type 2 diabetes. On behalf of the American Heart Association and American Medical Association, I want to thank you for taking the time to join today. My name is Liz Montgomery, and I am a data analyst on our Health Information Technology team working with the AHA and AMA on all things outpatient. And I'll be presenting on today's slides with my colleagues, Allison Smith, Sarah O'Kane, and you may hear from Catherine Overton during our Q&A sections as well. Allison and then Sarah, would you mind introducing yourselves?
Well, hello, everyone. Thank you for joining us. This is Allison Smith. I'm the program director for Target BP. I'm a nurse and public health professional, and I work on behalf of the Heart Association and the Medical Association. So thank you for joining us to learn more about recognition. Sarah?
Thank you, Allison. I'm Sarah O'Kane, Senior Product Development Manager of Outpatient. In addition to the strategic support of leadership of the recognition program operations, I work closely with our software vendor, IQVIA, on the development and maintenance of our software platforms that support our efforts to improve quality care in the outpatient space.
Great, thank you very much. All right, let's go ahead and move on. We do have a few housekeeping items just to keep things running smoothly. All participants have been placed on mute just to minimize background noise. However, we are accepting questions throughout the presentation in the questions feature on your screen. If you can please type in questions at any time there, we'll answer either in the chat or when we pause for questions at the end or throughout the presentation. We've got a few sections for that. After the webinar, we will be emailing the slide deck and the recording, and immediately after the webinar ends, a survey will appear on your screen. It should only take a minute to complete, and we would appreciate any feedback you can provide to help us improve our webinar, so please complete that. Let's go ahead and get started. As I mentioned earlier, today we will be digging into data submission. We'll start by giving an overview of our recognition programs with an emphasis on updates to the programs from last year, then highlight resources to help you throughout the recognition process, cover the essentials and tips for submitting data in the platform. We'll then pause to give you an opportunity to ask questions before we move into a more specific step-by-step walkthrough of submitting data for Target BP. First, though, we want to take a moment to congratulate again the tremendous work of all organizations that submitted 2021 data for 2022 recognition. Sarah, can you highlight some of the achievements this year?
Yeah, this past year we continued to see an increasing number of awardees. Of note, nearly 40% of organizations submitting for Target BP were able to achieve Gold or Gold Plus status, representing those with 70% or greater blood pressure control rates. And then 65% of our check change control cholesterol submitters achieved gold status with 70% or greater statin therapy rates among their at-risk populations. And 32% of our Target type 2 diabetes submitters achieved gold status with high performance on at least 2 clinical quality measures. So just a really impressive year, and we appreciate all the work that goes into pulling that data and taking the time to submit annually. Allison, I'll pass it to you to review Target BP's growth.
Thanks. Just in a little deeper detail, I think it's really informative to look back and what community has grown since the time we launched Target BP back in 2017. And you can see the patient population being served by organizations who participate has grown to 8 million. We've had more organizations than ever before this past year participate, which was quite impressive still in the throes of the pandemic. We're delighted to see 83 brand new first-time participants join us. And one of the things that I find most helpful and hopeful from a patient lens is that last year we awarded more organizations with gold status or high control and gold plus status with a control rate of 70% or greater than ever before, even pre-pandemic. So I find that extraordinarily exciting to see that continued dedication and growth. On the next slide, there's a little more data that digs into the blood pressure measurement activity attestations by year. And you can see, and I'll with the caveat that the validation question changed. So it's not an apples to apples comparison from the first to the second year that we had the attestation questions, but you can see substantial growth in all of these evidence-based blood pressure measurement activities, regardless of award status. So we're really looking forward to seeing what progress has been made since last year and building on this success. So with that, I will turn it back to Sarah.
So these next few slides just showcase how organizations who are committing time to implement these programs and follow guidelines for the care of at-risk populations as closely as possible, and then submit their data, are seeing results, and we're seeing improvement in their performance rates. So in our cholesterol program, 81 organizations saw an improvement of 5% or more in their statin therapy rate between the 2021 and 2022 recognition years. And then in the next slide, in our diabetes program, 85 organizations saw an improvement of 5% or more in their hemoglobin A1C control rate. And then in both programs, we've seen dozens of organizations move from participant level to gold, which is a huge morale boost for the staff who work so hard to move the needle in their organizations. So we're really proud of all of those achievers. Now, before we dig into data submission instructions, I think their next slide is a quick poll. So you should see a pop-up of a question asking, is your healthcare organization a first-time submitter, repeat submitter, or are you unsure? So we'll just take a moment to await responses for that.
So we've had about half of our attendees vote so far. We're still rising up though, so maybe give it just another moment before closing.
And this just helps us know our audience for the rest of the presentation, because we have detailed slides that might be a little too much for new submitters, but it also might be very helpful for repeat submitters. And so it just kind of helps us gauge where to emphasize our content.
All right, I'm going to go ahead and stop this. We are at about 60% repeat submitters and about 20% joining us for the first time, another 20% unsure. So we got a pretty good mix here, but lots of repeat submitters, which is exciting to see. Welcome back. And I will go ahead and move us on forward. So thank you again for both highlighting the improvements for our participants joining us. So we're going to start with walking through the timeline for the upcoming months. Right now, we are in the data submission period. You can edit or revise your data in our online platform anytime up until May 19th at 11:59 p.m. Eastern Time. Following that deadline, the AHA and AMA will be reviewing and validating the data submitted to classify awardees by award level. Then during the fall, we will notify awardees with your congratulations email and toolkit and publish your accomplishments on our program websites. The recognition doesn't end there. We'll follow those with additional highlights of awardees at scientific sessions and in a published national ad. For those who have been submitting for multiple years, we did want to call out that we've bumped up the deadline by 1 week this year. In the past, we've had the data submission deadline stay that final Friday of May, but we've decided to bump that up so it's no longer the Friday of Memorial Day weekend. We've heard of that competing with other plans and just making it a little more complicated. So be sure to mark your calendars for May 19th. And again, wanted to share some of those recognition benefits, including the expanded promotional toolkit, which includes an award certificate, social media messages, a local press release template, and the digital award icons. Some new additions from last year in 2022 that will continue forward include new templates for recognition videos, ads, and standing pull-up banners. So some really fun promotional items for those who participate and receive an award. Let's go ahead and move into our overview of the recognition programs. To be eligible for recognition in any of our 3 programs, your healthcare organization must directly diagnose and manage patients with chronic diseases, including prescribing and managing medications. If this doesn't apply to you directly, but you do support or educate providers, we have some spotlight opportunities and features available. For example, if you're a pharmacy or a community foundation or a Department of Health, please reach out to your local AHA representative for more details on how we can feature your work. And of course, all of our quality improvement tools remain available to all audiences. It's only the recognition piece that requires this eligibility criteria. Several fields are identical across all of our programs and should have the same answers. So we're going to touch on those first together. First, all will ask for the total adult patient population at your organization, ages 18 and up. Then we'll ask for a breakdown of that number by race and ethnicity. This breakdown is based on HRSA UDS reporting requirements for 2022 health center data. And I'll show this in a little bit more detail during our data walkthrough later in this presentation, but it is consistent from last year's table aside from one update to the unknown fields for race and ethnicity. That update is based on your feedback from last year to make it a little easier for you to answer. We'll also ask for a breakdown of the total adult patient population by their primary payer and for your total number of providers. Now let's move into the specifics of each program. So Allison, can you start us off with Target BP?
Sure, thanks, Liz. For Target BP, the award status levels are the same as last year, and those 4 are illustrated here. For all our award levels, you need to complete your data submission as well as your attestation questions, even if you choose the answer of unsure. That does preempt you from eligibility in that award category. But for participant, it's anybody who submits their data for the first time and has not yet achieved a control rate of 70% or greater, or has achieved fewer than 4 of the 6 evidence-based blood pressure measurement activities. For gold status, it's organizations who have achieved control rates of 70% or greater. For silver status, it's organizations who have achieved 4 of the 6 blood pressure measurement evidence-based criteria. And for gold plus, it's both the high control rate and 4 of 6 evidence-based activities. So same as last year. So let's dig into a little bit more of the details. There are some nuanced changes with the measure specifications. So the blood pressure control rate uses MIPS 236, the controlling high blood pressure measure. And the denominator this year has a slight change to it. It's sort of harkening back to pre-pandemic definition or specification. So it's the number of patients 18 to 85 who have had a visit in 2022, which is the measurement period we're talking about, and they have a diagnosis either before that period of essential hypertension or up through the first 6 months of 2022, so up until the end of June in 2022. The numerator for that measure is specified this year as the number of patients with a diagnosis of hypertension whose blood pressure is controlled as determined by the performance measure of less than 140 over less than 90. There's also a question just inquiring if your measure includes, if the patients being counted includes those with measurements transmitted through telehealth or remote self-measured blood pressure readings. And then there are also the 6 attestation questions, and we'll get to that in just a minute. I just want to dig a little deeper on the next slide into that change in the denominator. Again, it's for patients who have had a visit in 2022 had a diagnosis either before that time or up through the first 6 months of 2022. Last year, there was a longer diagnosis window that allowed that diagnosis to occur through the end of that measurement period, through December 2021. So that's different this year. So it's like returning to pre-pandemic specifications for the eligibility period of diagnosis, but they are still allowing telehealth visits and the measurements reported in that regard to be included. So there's just a few examples here of what would count as a patient to include in your denominator or a patient to exclude. So a patient who had a visit in March 2022 and was first diagnosed at that time would certainly be included because it's within the first 6 months of the year. A patient that had a visit in October 2022 and had their first diagnosis in October 22 would not be included because that diagnosis didn't occur in the first 6 months of the year. And then another example, a third one, is a patient who was seen in October of 2022 but had a pre-existing diagnosis, perhaps from the prior year. In this example, November, that person would be included in the denominator. Again, there's more details in the FAQs to go revisit these updates. I just want to comment next on the evidence-based blood pressure measurement activity attestation questions. There are 6 questions that fall into 3 buckets. The first around equipment calibration and validation, asking you first if you calibrate your blood pressure devices according to the evidence-based guidelines that are available in the AHA science documents, the blood pressure measurement guidelines, and the AHA scientific statement on blood pressure measurement in humans. And depending on the type of device you have, there's a frequency that is required to calibrate it and keep it accurate. We also are continuing to ask if you're checking to see if your devices are validated for clinical accuracy by going to the validated blood pressure device listing. The next 2 questions are about training your team. Are you strengthening your team's knowledge with training every 6 to 12 months and then testing their blood pressure measurement skills every 6 to 12 months according to guideline recommendations? And then lastly, from a systems of care standpoint, are you using a protocol that defines how you consistently measure blood pressure? And are you posting some type of visual reminder next to every place where blood pressure is measured to help ensure great technique and accurate measurement for every patient every time? If you attest affirmatively to 4 of 6 of those, it makes you eligible for Silver or Gold Plus. So with that, I think I'm turning it back to Liz to continue on.
Yes, thanks, Allison. So I will move on to check change control cholesterol next. And there we have 2 awards, participant and gold status. Organizations that submit 2022 data and commit to improving their ASCVD risk assessment and implementing ASCVD risk calculations into their clinical workflows and have 70% or more of their at-risk adult patient population appropriately managed per the measure guidelines will receive gold status. If they meet all of that criteria, but they fall underneath that 70% threshold, they will achieve participant status. So those are the 2 awards here. And the requirements for these awards are tied to the MIPS 438 measure, statin therapy for the prevention and treatment of cardiovascular disease. The denominator includes the number of patients meeting any of 3 risk group criteria, which we'll break down in the next slide. The numerator is the total patients from the denominator who are actively using or receive a prescription for statin therapy anytime during 2022. Know that you do need to use MIPS 438 for these answers using a different measure, including a custom definition of at-risk patients or pulling patients only with ASCVD is not acceptable for award eligibility in this program. We'll also ask for some more information on your use of the ASCVD risk score. We'll ask you how is it calculated and how is it documented. Finally, we'll ask about your organization if they operationalize a specific treatment plan for very high-risk patients, and if yes, the characteristics of that plan. Looking a little closer at the 3 risk group criteria from MIPS 438, they have changed a little since last year, but these changes make a fairly complicated measure a little bit simpler. So, for example, all patients who meet 1 or more of the criteria below would be considered at high risk for cardiovascular events under the ACC/AHA guidelines. When reporting this measure, you're going to determine if the patient meets the denominator eligibility in order of each risk category. So does the patient meet criteria 1? If not, do they meet criteria 2? If not, do they meet criteria 3? And that first criteria is for all patients, regardless of their age, who have been diagnosed with clinical ASCVD. Last year, this needed to be narrowed down to only patients ages 21 and up. So a little simpler there. And then the second criteria is patients aged 20 and up at the beginning of the measurement period and have ever had a fasting or direct lab results of LDL-C of over 190 milligrams per deciliter. So that one was just a minor change from 21 years to 20 years. And then the third criteria is patients aged 40 to 75 years at the beginning of the measurement period with type 1 or type 2 diabetes. Last year, there were additional criteria for these patients on their LDL-C level and when that measurement took place. So this simplifies it down to just that age range and that diagnosis of type 1 or type 2 diabetes. So hopefully a little bit simpler calculating this for 2022 data. Let's go ahead and move on to target type 2 diabetes. Sarah, can you break this down for us?
Yeah, thanks, Liz. So like check change control cholesterol, target type 2 diabetes has 2 award levels, participant and gold, and all organizations who fully complete submission will receive one of these awards. To achieve gold status, organizations must meet the participant criteria, which is effectively just completing data submission and answering a question that you commit to improving your protocols for addressing cardiovascular disease risk. And then you also will need to have the hemoglobin A1C levels in your population with diabetes to 25% or less poorly controlled. So basically, this is where we're talking about MIPS number 1, which is the HbA1c poor control measure. Patients with diabetes ages 18 to 85 whose HbA1c level was 9% or greater, greater than 9%, not equal to 9%, or they had no HbA1c level taken in 2022. The percentage of patients with that should be less than 25% or equal to 25% to count as gold. And then in addition to meeting that measure criteria, they must also meet a 70% or greater performance for either blood pressure control or statin therapy rates. Not on both, it could just be one of those measures. So the difference on this program is to meet gold, you need to meet the measure threshold for both the HbA1c measure and then at least one of the other measures. So if you want to go to the next slide. So here's the detailed criteria for the HbA1c poor control numerator and denominator. And this is unchanged from prior years, but the thing that I do want to note again is we are measuring patients who have poor control. So this is looking at patients who have a high HbA1c level or no HbA1c level taken in 2022. Those are the patients that count in the numerator. So ultimately, we want performance to be low on this measure. That's good, as opposed to a high performance. A high performance means that patients' HbA1c levels are out of control. But overall, the core criteria for this award program is the same as it's been since the inception. There is a change in our clinical practice questions, though, so we'll go into that in more detail. We have added 5 questions around clinical practices in your organization. If you want to go to the next slide, Liz. And so these are the details on the cardiovascular disease focused measures that are required for completion, but you will achieve gold status if, in addition to the HbA1c measure, you are also achieving 70% or greater performance on one of these measures. And the key thing to note here is that these are the same measures, same totals that we're asking in the other two programs. So we have the statin therapy measure that we ask in check change control cholesterol, and that is the same exact measure that we're asking here. And then in target BP, we're asking for controlling high BP, and you would submit the same totals in this program. I will say, unfortunately, we don't have any kind of a software mechanism to auto-populate your responses from these two programs into your target type 2 diabetes submission form. So you will have to retype those totals, but hopefully it'll only take a few seconds, and it's truly just a copy and paste, so you don't need to do any additional calculations for this program. Next slide, please. All right, so just a quick overview of our new clinical practice questions for target type 2 diabetes. So as part of a phase 2 of No Diabetes by Heart, which is the parent program of target type 2 diabetes, we are really focusing on how we can hone in on the techniques that really reduce cardiovascular disease and death in patients with type 2 diabetes. So more than 34 million Americans live with diabetes. 90 to 95% of those individuals have type 2 diabetes. So we are honing in on supporting physicians through team-based care, improving awareness of and adherence to game-changing medical therapies, and supporting kidney health. And now kidney health might seem a little out of left field, but patients with type 2 diabetes and kidney disease are at 3 times higher risk of dying from a cardiovascular event. So as such, we have added several questions to the diabetes form about your organization's clinical practices in these areas. So on the slide, you can see we have our questions around standard protocols and treatment plans, which those are questions we've been asking in this program since the beginning. They're slightly modified, but not much. I think we added a few response options, but basically the same overall questions. But then we added questions around pharmacological therapies and barriers to prescribing them, and then a question about kidney health evaluation. So these questions do have to be completed to be eligible for awards, but any response is acceptable. And we have an I don't know option on all of the questions. So you could say I don't know on every question and answer the measure questions and still get an award. However, if you're able to connect with your colleagues in your organization who are knowledgeable in the practices in these areas and you can answer as best as you can, that is a tremendous help for us to not only create specific resources to address the actual needs that organizations have around treating patients with type 2 diabetes, but also allows for your local AHA field staff who might work with you and support your organization to know what your needs are and help provide targeted support for your organization. So having accurate answers on these questions to the best of your knowledge really does help us. So if you want to go to the next slide, Liz, for the sake of time, we won't go super in depth into the exact questions and response options. You can see, I think in the webinar, we've attached the data collection worksheet that does have the full questions and options. And then I think on that prior slide, we have a webinar, thank you, Liz, that will cover all of this in detail coming up on February 7th. So get questions answered there, and you'll hear from one of our volunteers, Dr. Dana Weishar. So if you want to go back to the next slide, Liz. So these are the questions that we already have in the form, but they've just gotten a little bit tweaked. You can go to the next slide. These are some of our new questions. So we are asking about therapies being prescribed for patients with type 2 diabetes, specifically focusing on ACE, ARBs, or ARNIs, other antihypertensives, lipid-lowering medications, DPP-4 inhibitors, and then what the AHA and the American Diabetes Association have called game changers, SGLT2 inhibitors, and GLP-1 receptor agonists. And then we're also really looking to see what organizational barriers you might be experiencing in prescribing these more advanced medications. You can go to the next slide. And then last but not least, we have our question about the routine evaluation of kidney health in patients with type 2 diabetes. So this is a pretty high-level overview of these new questions. So I do want to direct everyone to the great resource guide that the team put together. It provides details on all the evidence behind these questions, as well as additional resources to support your efforts in incorporating these newer therapies and protocols. So I will pass it back to Liz, I think.
Yes, thank you so much. I'm just going to continue on that same topic of helpful resources. We've put together a great suite of resources in addition to this webinar to help organizations with data submission. Our data collection worksheets break down questions in great detail, so we've been referring to these throughout the whole presentation. Really a key resource, especially for the payer group question. And they are available for all 3 programs online now. You can also access these in the handouts feature of GoToWebinar. So you can access them right now or find them on the program websites and in the library of the online data platform. We've also compiled a quick user guide, which is a PDF that breaks down the steps the data submission processes we'll be sharing soon, or excuse me, this is a PDF that breaks down the steps of the data submission process. So I'll be doing a walkthrough of that, but this will go into depth on all 3 programs. It's also available on our websites and in the library. Data submission video tutorials that also walk through step by step will be available in the next month or 2. And that moves us to a pop quiz. So we do have another poll for you. I'm going to go ahead and launch that now. We are asking, when is the data submission deadline? So we've covered it a couple of times and just wanted to make sure you're still listening. Right now, I see we've got about 40% going upwards to 50%. Have a few on May 27th or May 31st, but it's looking like we are on track. We've got 96% selected Friday, May 19th as the data submission deadline, and that is correct. It is May 19th. I'm going to go ahead and close the poll, just keep everyone on their toes a little bit, but this is a week earlier than previous years, so please bookmark May 19th. And it is at 11:59 p.m. Eastern time, so just before midnight if you're getting it in at the wire. Wonderful to see those primarily correct answers, and now we can go ahead and transition into data submission and a few data submission details for getting started. Sarah, you want to take it over? And then we'll have, after this section, we have a Q&A session where we can break down some of the questions that have been coming in.
Yeah, thanks, Liz. So these are the core steps for getting started with submitting data. So the key things to know are how to register if you are new to recognition. So you don't have to register if you have submitted data before and your organization is already participating with us. So you can just skip right to entering data online. But if your organization is new to data submission, or if you have a location that has not submitted before, then you will want to make sure they get registered. And that registration link is at heart.org/registermyoutpatient.org. And we wanted to note that the one registration equals one potential awardee. So if you want to have multiple locations or multiple different clinics eligible for an award, you'll need to submit a separate registration form for each of those entities. And if you have more than 5, or I mean, you could submit it for fewer than that, but it's just kind of a pain. But if you have multiple that you want to submit at once, there is a multi-site registration option where you can basically fill out the form plus a spreadsheet, but it's a little bit more effort. So, if you don't have that many sites, then it works to also just submit the regular registration form multiple times. But the nice thing is that you can register for all 3 outpatient programs at the same time. So you don't have to fill out this form for each of the programs. You could register an organization for target BP, check change control cholesterol, and target type 2 diabetes simultaneously with one form. And this is a manual process on our end to actually get you added to the system. So you should get your username and password to log into the data submission platform within 3 business days. So just give us a little bit of time on that. But once you get that, then you can proceed to the next step, which is entering data online. So just want to re-emphasize that registering is the first step. It is not the final step. That does not constitute data submission. So the actual data submission, where you answer the questions about your measure performance and your clinical practices and all of that, that happens once you get your login, and you will be able to log in at the actual submission platform at aha.infusario-registry.com. Now, again, the deadline to enter this data is Friday, May 19th of this year. But during this period, you can enter data at any point in time. You can go back and edit it. There's no reopening the form or asking for permission to change anything. You can just go in, add data, delete data, edit data at any point up until the deadline. But then when that deadline happens at midnight, we basically take a snapshot of what data exists in the platform at that point in time, and that's what we use to determine award status for everyone. And was this me, Liz, or was this you? Or sorry, yeah.
It does not matter. I can I can certainly take from here. So we do have a self-service upload tool. This is a feature for organizations who have more than 5 different sites and want to upload it kind of in one fell swoop. So essentially you'll be putting together a spreadsheet of the data that you're submitting. Sarah walked us through how to register for more than 5 different sites who would like to receive recognition specific to those individual clinics or locations. And so you would essentially list those line by line for each organization. If you're interested in this option, then we suggest that you reach out to your local AHA director, usually a community impact staff person, for more information, and they can walk you through the step-by-step details on how to fill out this information and complete it. They'll provide all of the templates for you. And if you don't know who your local AHA staff person is, you can submit a request at bit.ly/AQ-contact-us. That is our primary contact us questions form, and we will connect you with your local person to help you with that. And just a visual of what that looks like in the platform itself, you just populate that CSV file and drop it into the platform. Again, like with registering, this is really helpful if you've got a lot of organizations. It is time saving, but can be more time consuming if you're only submitting for one or for like 2 organizations. And then reaching out after the AHA submission deadline, you might hear from one of us on after the data submission deadline if we have a question about your data. So please respond as soon as you're able to. This might come from the national team or from your local AHA representative. A few of the reasons that we might reach out would be if the measure performance rate is very, very high or very low. For example, if it's a really high percentage rate for target type 2 diabetes, we might be like, this, did you not notice if this was an inverse measure, and just wanting to make sure that we have captured the right data and it wasn't a misunderstanding. Another reason is if we see a mismatch of data between target BP and target type 2 diabetes or cholesterol, where you're submitting for the same measure multiple times, but including different information. We're wanting to know where those numbers are coming from and make sure that we have the accurate submission for your award. We might also ask about your answer given if you have a very low percentage of total adult at-risk patients given for the denominator of the statin measure, for the statin therapy measure. Or if there are fields that were left blank, but we usually try and reach out before the data submission deadline for those, especially because we do want to make sure to capture all of the information. And a couple of tips for you to make sure that things go smoothly, and then we'll jump into questions. But we don't want a technical glitch or a forgotten field to block you from being recognized. So please make sure to enter your data by Friday, May 19th, but the earlier the better. If you're new, register early because it does take a little bit of time to set up your profile. And when you're entering data, be sure to use our resources for the full instructions and complete all fields and all tabs. So double check your work, make sure that there are no blanks, but the earlier that you submit your data, the more likely we are to be able to catch anything that may have come up or any last minute questions and answer them for you. I also want to call out the excuse me, the data entry complete checkbox. That will only become available when you have completed all of the required fields. So a good way to make sure that you haven't missed anything as you are completing your forms is to check that box on the front page, or the front page of your program form, and save before exiting. Now we can go ahead and move to some questions. I've seen some come in and we'll answer them live, but before we start calling those out, I want to call out a couple of common questions. We will be sending the PowerPoint presentation along with the recording of the call to all registered attendees. Even those who have missed the session will receive the PowerPoint and recording. A recording will be added to the website as well, and that will include closed captioning. So if you wanted to wait for the closed captioning, you can find this recording online at Target BP and our other program websites within a couple of weeks after the close of this. I also wanted to mention, again, our AQ Contact Us form. It's a great way for us to get you in contact with your local AHA representative if you're not sure who that individual is. And that person can also help you with password resets, new user accounts, alongside our IQVIA support help desk. And the email address and phone number is there for any new or new accounts, or if you have an existing user account that needs a reactivation, a password reset because it's been a while since you've logged in, those are all being able to be addressed through that support help desk. Now let's go ahead and see what kind of questions came in. Allison or Sarah, do you have any ready that you wanted to call out?
Yeah, I think early on we got a question about the patient population for Target BP. They asked if patients who are members or they're part of the healthcare organization but they have been diagnosed with hypertension, but they're unresponsive and they haven't had an appointment in years. They're asking if they include those as part of their patient population with hypertension for the denominator of the measure? And the answer to that is no. The denominator for the controlling high blood pressure measure is limited to patients with hypertension who have had a visit in 2022. So if they haven't been seen in several years, then they don't count.
Okay, that's really helpful to know. Okay.
And let's see if there, I don't know if,
So lots of great questions coming in. Some we've hit on, I think, in the presentation since they've been asked, but you will get the recording and the slides as a follow-up to this, and they'll be available for your review in addition to the upcoming office hours that we'll have, where we can help with troubleshooting questions that you might encounter along the way.
All right, I will call out, there's a question about why we have 5 months for organizations to submit data. And I will just add on to the answer that was given in the chat and let everyone know we want to make sure that you have enough time to be fully supported as you walk through these questions. You know, UDS might have their required questions come in earlier in the year, but we have additional attestation questions that we really appreciate your answers to, as Sarah called out, for these new clinical practice questions for target type 2 diabetes, and it applies across all of the programs. You know, even if there is an unknown answer that you can select, we want to give you the time to really consider them and be able to answer for support of our organization and our improvement for the resources that we give organizations moving forward.
I see one question that's popped up about which patients to include, and I think it depends, first of all, which program you're referring to, whether it's blood pressure, cholesterol, or type 2 diabetes, and the measure specifications are helpful to review in terms of which patients are included or not. So for example, in hypertension, you know, patients who are pregnant or patients who are in hospice are excluded from the measure. And then the other question is, you know, are we including patients seen for primary care or for specialty care? And I think it depends on the entity that is submitting data. So is it for the entire health system? Is it for an individual clinic? And so that I think would determine which patients, you know, between the measure specifications and the entity submitting data will influence that. I don't know if Sarah, Liz, or if you want to add on to that in terms of clarity at all.
yeah, if we're talking about the patient population and who qualifies, the actual measure specifications that CMS provides are pretty detailed in terms of helping identify the qualifying encounters as well. So you know, there are specific CPT codes that will count for a patient to be included in the denominator of the measure. So you know, if they had a psychiatric visit or something like that, you know, they wouldn't count for the denominator. That wouldn't be a visit that counts. But if they have a qualifying outpatient visit to a specialty department that doesn't have the ability to manage and treat hypertension, you know, like a dental visit or something like that, then that you might have to manually exclude those if they have a qualifying CPT code, but they're not in a department that you want to include. You would just want to make sure that any of your other answers on the form reflect that same population and that you exclude those patients in your other answers. So like don't include them as your part of your total patient population.
Thanks, Sarah. I do want to call out, for just the sake of time, we do want to move through our form walkthrough, but there are also great questions coming in. We do have very comprehensive FAQs that I will include alongside the slides for this presentation in a follow-up email, as well as additional resources and the link for our upcoming Q&A sessions that we'll hold in March and again in May ahead of the deadline. So just want to go ahead and move forward, but if your question hasn't been answered yet, we'll try and answer it in the future for GoToWebinar now or in a follow-up email after this. But unless you guys had anything else to add, I'll move forward to our platform walkthrough. All right, great. So I'm going to go ahead and move forward and do a walkthrough of the data submission platform. The first step after registering is logging in at aha.infosariaregistry.com/login. If it's been a while since you've logged in and you've forgotten your password, you can use the forgot password link or the need help options. And for accounts that have been deactivated over time due to too much time passing between logins, you can also contact your local AHA representative or use that contact us form I called out earlier in the presentation. If it's your first time in the platform or you're updating from a temporary password, you'll be prompted to create a permanent password. Then the first time you enter the platform, you will see our full data use and license agreement for the ambulatory quality registry. Read through and click agree at the bottom. And then now that you're logged in, don't forget to set up challenge questions for your password. These will enable you to reset your password in the future without contacting the help desk. So it'll make it a little easier for you. If you have access to multiple organizations, or if you're submitting, for example, multiple clinics within a single system, you'll be prompted to select a view, and you can choose the organization or facility in the platform you are currently planning to submit data for. This will bring you to your community page. If you do need to navigate back to another facility, you can do that by clicking the teal Switch Current View button. The top right of the community page has a series of navigation tips to help you out. And you will submit data using program forms. You can navigate there by clicking the link on the left navigation bar or the icon under Get Started. You can add site characteristics and form management to benchmark your organization against similar organizations. You can review reports by clicking Operational Reports under Analytics. And to access helpful data submission resources and measure guides, you can click on the library. The platform library includes our data collection worksheets, quick user guides, they frequently asked questions, and the measure specifications. So if you have a question about one of the fields required for data submission, the library will probably have the answer for you. All right, now let's go ahead and walk through the submission process. Remember, we submit our data using the program forms. In our first view under program forms, you'll be able to see any forms that have previously been opened under edit forms. To begin a new form, you'll click add new to the desired program. This demo is on Target BP, so I would click add new next to that program. And note that you'll only be able to add forms for the programs your organization is registered for. You'll type 2022 into the reporting year field because you're submitting 2022 data for 2023 recognition and hit submit. Remember to save as you go and complete both tabs. You'll need to answer all questions to be eligible for recognition. So that does include the data on both tabs, and you can find that on the right. The first two questions for Target BP are required for award eligibility, and question 3 is that total adult patient question. Be sure that you have access to both the payer data and demographic data for that total. Questions 4 and 5 are the denominator and numerator that Allison walked through earlier. 6 and 7 are required but do not affect award status. And I'm moving along quick because we're right at the end, but I did want to get to this spot here, which is our breakdown of race and ethnicity. And then there will also be a second question breaking down your payer group. And under the race and ethnicity field, this does equate to the UDS HRSA's reporting requirements for 2022 data. You'll need that total to The auto total will calculate in the gray box, and you'll need that to calculate to the same number as your total patients. Now, the change this year is in that unknown category. We have added greater context, so now you don't need to group all unknown patients together, but can split them apart by unreported or unknown race. However, if they identify as Latino or Hispanic, you can add that number there. So we want to be able to include the ethnicity if we have it, even if they haven't reported their race. And then we have a category for the race being known, but the ethnicity being unknown, and for both the race and ethnicity unknown or unreported. If you don't have a breakdown by all three categories, you can do 0 for the categories that you don't have a number for, and then just sum them up to the final total patient unknown or unreported count. Make sure to save as you go, and then the next tab is all of the 6 evidence-based blood pressure activities for Silver and Gold Plus. And I'm going to skim ahead just a little bit here. We have the data collection worksheet, which will help you answer those questions. And click the data entry complete checkbox when you're finished, save and exit, and you will be wrapped up. The process is going to be similar for check change control cholesterol and target type 2 diabetes, but there is an additional form for diabetes. And I am going to go ahead and just skip to the end because these are all covered in our data collection worksheet. And I will also just mention that the demo videos that will be coming soon will do that same step-by-step walkthrough, but we'll have a little bit more time. So if you do want that same walkthrough, but going into greater context, we will be providing that for you online that can be accessed through all of our program websites. And you can see those program websites online here underneath step 4. So thank you all for joining today. I will pause for just a second to see if Allison or Sarah wanted to add anything to wrap us up. I know we are over time, and I greatly appreciate all of your time today.
No, thank you so much for the quick run through, and to everyone for your participation. We're really enthused to learn about your performance this last year and celebrate your success.
Wonderful. Well, thank you again. And if you do have any questions, please reach out at bit.ly/AQ contact us. We will follow up with an email, including just answers to all of our frequently asked questions and any specifics that we weren't able to get to today. We'd love your feedback in the post-webinar survey. So please, please take the time to complete that if you have it available. And I look forward to seeing all of the submissions come in. Thank you very much.